The arterial system is very elastic, and then when the heart is relaxing and the pressure is lower, then the arteries will recoil. There's an elastic recoil. And that elastic recoil is pressing on the blood which is left in the arterial system. And that maintains a diastolic blood pressure. So the systolic blood pressure is the pressure when the heart is actually contracting. The diastolic pressure is the pressure in the arterial system when the heart is in its resting phase. So the systolic and the diastolic blood pressure. Now, I mentioned that when we're talking about blood pressure, we mean normally the pressure in the arterial system, in the systemic arterial system. But there's a few other blood pressures I'm just going to mention now to save confusion. So systemic blood pressure, normally about 120 over 80 millimeters of mercury, the pressure in an adult systemic arterial system. Now, do you remember that the aorta leaves the left side of the heart and supplies all the arteries of the body? Now, what is the artery that leaves the right ventricle of the heart? Well, the artery that leaves the right ventricle of the heart is the pulmonary artery, and it perfuses the lungs. It perfuses the lungs. And my heart is here, and my lungs are here. So really it's not that far to go, is it? Fairly short distance. So the pressure needed to perfuse the lungs is less than the pressure needed to perfuse my head and my feet all at the same time. So pulmonary blood pressure is going to be lower than systemic blood pressure. This is generated by the left side of the heart. This is generated by the right side of the heart. So something like 25 over 8 millimeters of mercury might be a normal pulmonary arterial blood pressure. Now, there's a pressure in the veins as well. And the pressure in the veins varies a lot, depending on what you're doing and what part of the body you're looking at. If there's a lot of blood pooling in the bottom of your legs, it could be quite high. Other times, the venous blood pressure is going to be essentially zero. But let's just take an example. Say one of the veins in the top of the arm, the blood pressure there would normally be something like, let's say 6 to 8 millimeters of mercury as a reasonable blood pressure in a largish vein. So the pressure in the systemic arterial system generated by the left ventricle, the pressure in the pulmonary arterial system generated by the right ventricle, and the venous blood pressure 6 to 8 millimeters of mercury generated by the mechanisms of venous return, such as adjacent muscle contraction, adjacent arterial contraction, and negative pressure set up during ventilation of the lungs. And the final one I'm going to mention in this section, capillary blood pressure. Well, capillary blood pressure is the pressure of the blood in the capillaries. Now, at the arterial end of the capillary, the pressure might be, say, 32 millimeters of mercury, and that probably drops down to around about 12 millimeters of mercury at the venous end of the capillary. So the pressure in the capillaries lower than in the arteries, but somewhat higher than in the venous system. And we're going to look at the factors that determine blood pressure. And I want to write down a couple of equations to start off our thinking about this. Now, blood pressure equals cardiac output times multiplied by peripheral resistance. So the blood pressure is equal to the cardiac output times the peripheral resistance. The cardiac output is itself equal to heart rate multiplied by the stroke volume. Now let's think about what these terms mean. Blood pressure equals cardiac output times peripheral resistance. So let's start with the cardiac output to decide what cardiac output means. Now, cardiac output is actually a volume of blood pumped out by the heart per minute, pumped out by the left ventricle per minute in this case. So cardiac output equals heart rate. So let's say a normal heart rate is 70 beats per minute. So the heart is beating 70 times per minute. And let's assume that the stroke volume is, say, also 70 mils. So 70 times a minute, the heart is beating out 70 mils of blood, which would equal 4,900 mils a minute. In other words, round about 5 litres. So cardiac output is heart rate times stroke volume, the number of times the heart is beating per minute or contracting per minute, multiplied by the volume of blood ejected every time the heart contracts, the stroke volume. So cardiac output is a figure, so many litres of blood per minute, and a cardiac output of, say, 5 litres of blood per minute would be normal when a person is reasonably at rest. So the blood pressure itself equals this amount of blood pumped out per minute, the cardiac output. But the other main thing affecting blood pressure is the peripheral resistance. Now, if the peripheral resistance increases because there's a peripheral vasoconstriction, because the blood vessels get smaller, then the blood pressure will go up. Because when the vessels get smaller, when the arterial vessels get smaller, the peripheral resistance will increase. However, if the peripheral arterial system, and we're primarily talking about the arterioles here, if the arterioles dilate, get wider, then the peripheral resistance will fall and the blood pressure will also fall. So blood pressure is equal to cardiac output times peripheral resistance, and cardiac output is itself determined by heart rate times stroke volume. I think I'll just mention one other thing here. Blood viscosity. It's not normally a factor, but it can come into play. Now, if blood viscosity increases, then blood pressure will also increase. This doesn't happen very often, but sometimes a patient produces too many red blood cells, a condition called polycythemia, and that can raise the blood pressure. So more viscous blood will be at a higher pressure. Alternatively, if the patient drinks an awful lot, or they're infused with normal saline, for example, and the blood viscosity drops, then blood pressure will also drop. So blood viscosity can also affect blood pressure. But basically, the one to memorize is blood pressure equals cardiac output times peripheral resistance, and cardiac output equals heart rate times stroke volume. Now, just before we go on, let's have a short illustration. Now, we can illustrate the effects of cardiac output and resistance, peripheral resistance, just with an ordinary tap. It's an analogy. So there's the tap working now. Now, if I increase the flow rate of water by turning up the tap, that is, if I increase the cardiac output, the amount of blood that's being pumped out by the heart, then that's the same as increasing the flow rate. And if we increase the flow rate, well, we're going to increase the pressure. So there we have a low cardiac output with a low pressure, higher cardiac output